Well, welcome to Deeply Rooted Botanical Medicine with Stephanie Georgiev. That's me. I'm your host, an instructor for all things botanical medicine. Make sure to check out the links in the program notes. I'm running a little special during the lovely month of July on cardiac medicines coming from the plant world. And this is a little mini taste of the larger Living Pharmacy course. And it's very comprehensive. It covers everything you could possibly want to know about cardiovascular health and how to facilitate it through nutrition, supplements, as well as wonderful gifts from nature. And so, without further ado, we're going to enter our weekly feature, which happens every Wednesday on Deeply Rooted, and I call it This Week in Botanical Medicine. And what I decided to do for this week was look at some really interesting new research that has come out. One of the more pleasant aspects of my expertise seeking is that I love to look through all these wonderful journals that are dedicated to what is called now integrative medicine. And this is basically a phrase that's given to what everybody's been doing for the last 20 or 30 years, which means they're combining different types of approaches to medicine, which means orthodox medicine is usually what MDs practice, and it's a wonderful profession. We're very grateful to them. And so this is things like lab work and x-rays and, doing tissue samples and urine tests and things like that. And basically utilizing things like surgery and pharmacy, pharmaceutical drugs in order to address health and healing. And then everything else, which is what is sort of lumped in with things like natural medicine, botanical medicine, things like chiropractic and acupuncture and naturopathy and homeopathy. Those are all kind of loosely under natural medicine. And if you combine everything together, you have what's called integrative medicine. And so for me, a white-haired herbalist that's been at this for quite a while, back in the day, there was only maybe 2 or 3 journals that you could get, and you usually had to smuggle them in from Canada if you were in the United States. And they were usually German publications. I'm sorry I don't still have a lot of those journals because they were really good. I really enjoyed them. But now there's all kinds of wonderful journals that are available. And so it's really a treat for me to be able to scour these journals for really interesting research that's just burgeoning all over the planet. And one of the studies that was published in the B as in boy, MC, Complementary Medicine and Therapies magazine or journal, and the BMC basically stands for Biomed Central, and this is a commercial publisher focusing on open access scientific research. It's part of the Springer Nature Publishing Group, and which is based in the United Kingdom. The United Kingdom has been using what we would call natural, complementary, and integrative medicine forever, especially since Henry VIII's time. And this is really a wonderful publication. And so this study was published in the July issue of 2026, and it's called The Mechanism of Danjiang Granules. And this was given the label T as in toy, D as in dog, X as in X-ray 105. So Mechanism of Danjiang Granules, TDX 105. and the use of that for radiation dermatitis. Now, before I get into this really lovely study, the Danjiang part of this title, this refers to the primary herbs in the formula, the primary botanical medicines in the formula. And the first herb is called Dan Pi, and this is for Mutan cortex. Zhang from the Chanjiang Linguisticum Chanjiang, and the Danjiang granules are not from a classical TCM formulas. Okay, this is a modern clinical formulation that has been developed and refined over the last 10 to 15 years, specifically for use in integrative oncology settings. And the TDX 105, this is an alphanumeric identifier assigned to the specific standardized mixture. And this is really interesting because researchers have used these granules, which are basically like freeze-dried tea. So they make a tea out of this herbal formula and they freeze dry it and they get these little granules. And what they're doing is they're applying this to what we modern science people would call randomized double-blind trials. And they use these codes to ensure that the granules are distinct from the placebo or control treatments. So we're going to see a lot of that in a lot of modern research. And I think this is really interesting because when you learn all about traditional Chinese medicine, you learn these classic formulas that have been in use for anywhere from 500 to 1,000 to 1,500 years. And what clinicians are doing now, particularly in China, is they're drawing on this really wonderful, well-documented, thousands of year old therapies with plants, and they're saying, well, let's try this. And then they put them through these rigorous trials. So it's really interesting. And basically, the reason for this study is that dermatitis, which is basically redness, itchy, swelling, it caused by radiation, is a common and very painful side effect of cancer therapy, the kind where you're getting radiation. And the Danjiang granules, TDX 105, they've been used clinically for over a decade, but their exact how-to, why it worked, was a mystery. And so now we understand this through this study. And basically, researchers had identified 73 active constituents, including quercetin, camphorol, balicalin, amongst others. And all of those wonderful words that I just mentioned, these have anti-inflammatory properties. And the study found that the TDX 105 basically modulates several critical signaling pathways. And by inhibiting these, and these are basically pathways that cause inflammation and redness. By inhibiting these pathways, the granules reduce the inflammation markers, and ones that you're probably most familiar with, it's called the COX-2, and any type of aspirin or ibuprofen or NSAIDs, whatever you want to call them, they usually inhibit that, so it stops the inflammation. And the researchers used molecular docking, which is basically computer modeling, to confirm these herbal compounds successfully bind to target proteins in the body to exert their therapeutic effect. And this was confirmed in vitro, which basically means they were irradiating tissues in a little petri dish and caused them to inflame. They put this solution on it and it didn't happen. So it doesn't sound like Yeah, didn't sound like any animals or people were tortured with this. And what is so interesting about this is that this is a story of ancient wisdom meeting modern science, and it's going beyond anecdotal information. And we don't want to diminish anecdotes, but sometimes something that happens one time, and it did happen that one time, doesn't mean that it's going to happen again. And so if you're suffering from a disease, and you or a side effect of a treatment such as radiation, you're getting burned by your radiation treatments, it's really lovely to know that, gosh, this really does work. And not only does it work, it's plant based. Now, the other really interesting study that was announced in this wonderful journal, actually, it was featured in the Journal of Integrative Medicine. And this is addressing one of the biggest hurdles in herbal medicine, which is called bioavailability. And if you're watching any kind of online YouTube commercials, particularly about herbs, or you're up on your supplements, and when I used to work in an integrative pharmacy, we were always being inundated by products that's saying, well, this is more available, bioavailable than other things, and you need to combine stuff and blah, blah, blah. So, what this is looking at is this study is looking at certain herbal compounds, particularly curcumin, which is found in turmeric. And basically, you buy these lovely little tea bags in these beautiful boxes. It's like, oh, it's going to address such and so. Well, that's not necessarily true. It doesn't mean that it's not delicious, but it doesn't necessarily mean you're going to get a therapeutic effect from it. And this is really true with turmeric, because turmeric in its raw form, which is gorgeous and delicious, is sometimes difficult for the human body to absorb. Or as soon as you do absorb it, it doesn't do its magic the way you want to. And so what's happening right now is they're developing nanotechnology based systems to deliver botanical medicines. And they're looking at carrier-based systems. These are using materials like lipids or polymers or nano emulsions that will package herbal extracts, and which will protect them from degradation in the stomach and help them to cross cell membranes more efficiently. And an emerging trend which was discussed in this study is the carrier-free material systems. And this is basically looking at nanonization, and it's shrinking the herbal compounds themselves down to nanoscale, which improves the solubility and permeability without the need of additional synthetic carrier medicine. So this is really fascinating. And what's really fascinating about all of this is it's getting at something I got a little bit of a flack for in my last This Week in Botanical Medicine, when I was talking about the World Health Organization, and this is WHO. And what I was getting from that was that people were accusing me of saying that the World Health Organization was going to monitor and regulate herbal supplements, and I was being brainwashed, and that my personal government has withdrawn from the World Health Organization, and that I see this withdrawal from the World Health Organization as not a good thing, specifically for botanical medicine. And this goes back from my experience attending the Fourth International Conference on Women in Beijing, China. And what happens at these UN international conferences. And for the most part, the United Nations, they have all sorts of conferences and they declare certain years and decades for things. And my little brother actually participated in the International Year of the Child. This was the United Nations International Year of the Child. And this conference was held in Sofia, Bulgaria in 1979, I think it was. I may be wrong on that. And my brother was part of the American delegation of children who submitted artwork for the cultural aspect. And my whole family went there to cheer him on as part of the American delegation, which was really, really wonderful. And even though at that point Bulgaria was still communist, they put in one heck of a conference. And I will never forget the artistic presentations that Bulgaria had. They had these wonderful dances with it was just amazing. So, what comes out of these international conferences are things that are called draft plan for action. And they need to be ratified by all member states. And there's lots of debates and all sorts of things that go into these draft plan for actions, and lots of arguments and certain things. Basically, a draft plan for action is to say things like, all children deserve to drink clean water. They'll make a draft plan that says that. And then they'll give certain suggestions to make sure that children have access to clean drinking water. And everybody ratifies that. I think there's like 170 countries that participate in the United Nations. And if everybody agrees that children should drink clean water, then this draft plan goes back with everybody that's a representative of their various countries, and they start lobbying their respective governments to start making sure that children have access to clean water. And of course, there are certain groups that think this is meddling, and the UN is forcing children to drink clean water and all that sort of stuff. So at the international conference in Beijing that I personally attended, specifically to see what would happen with the inclusion of natural medicine in the draft plan for action. And in most UN conferences that have anything to do with human rights, they usually have some emphasis on healthcare, that there should be access to healthcare, adequate nutrition, all sorts of things like that. And I had participated in the different discussions leading up to the fourth conference on women in Beijing in 1995. And I wanted to see how that was going to work. And to my utter delight, the access and support to what is called traditional medicine, which essentially means botanical medicine and different medicine practices such as acupuncture and Tai Chi and Qigong and yoga and all sorts of things like that. That was in the draft plan for action. And it was universally ratified by every member state. There was no debate. There was no argument. Nobody said that, you can't have this. And so it came out in this document that governments, because women are the primary healthcare providers, both, licensed and non-licensed, and that most of the world did not have access to technology and pharmaceuticals, that that governance needed to make sure that these traditional forms of medicine were accessible, legal, and also effective, and were what they said they were. And so this was universally ratified, and it influenced the World Health Organization, which is the WHO. And what the World Health Organization has been doing since then is it's been creating meetings, regional conferences all over the world to basically encourage and support individual governments in making sure that access to traditional medicine is a safe and effective thing. And they want to encourage education for traditional medicine. And they also want to create databases that everybody can have access to, so that if a practitioner or a consumer wants to say, gee, I'd like to have a Danjiang TDX 250 granules for my radiation burn, that it actually works. And that's what the World Health Organization is doing. And it all started with this draft plan for action, which has influenced every nation all over the planet. And what we're seeing is, in my opinion, really exciting. And not only are they doing research, this is building sustainable economies all over the planet, not only in developed countries, but also in developing countries. It's creating entire sustainable economies, and it's doing wonderful things. And so for me to feel badly as a citizen of a country that has stopped being part of this, that's a valid complaint. And what I do hope is that when a certain administration is no longer in power, that they will rejoin this wonderful global initiative, because it will benefit my country and the people in my country, specifically for botanical medicine. That's why I said that. And so, and I reviewed the podcast. I wasn't angry. I wasn't, saying anything that would get me in any trouble. But there are certain words that set off people for reasons that I don't understand. I appreciate that everyone has their opinions. I appreciate that. I'm not arguing with that. But I think it was Winston Churchill. He said, everyone is entitled to their opinion, but not everybody is entitled to their own facts. And what the World Health Organization is doing for botanical medicine is truly remarkable. And it started in 1995, a draft plan for action at the 4th International Conference on Women. And I attended that, and people were saying, back then that, the Chinese, because it was in China, the Chinese were eating aborted babies and all this other stuff. And it just was not true, the criticisms. And I've always been interested in where these ideas come from. It's always a good idea to, investigate what's going on. But so anyways, I just wanted to address some of the very passionate criticisms, and I totally respect people's right to express that. But the criticisms were very interesting to me, mainly because I think that if they listened to the entire podcast and didn't get all upset because they heard certain words that upset them, and if they understood the historical background to these statements that they might have not had their responses. And, they, of course, I was told that, they would never listen to this again, and on and on. And, that's the glory of freedom of the press and freedom of access. That if you don't want to listen to something, you don't have to. But stop listening based on something that's actually valid. And, but if you want to join me in this true delight and also deep, I don't know what the word is, deep happiness that the world's people are going to have access to botanical medicine. And the fact that this will be creating sustainable economies and celebrate traditional knowledge and really delve into how all of this works, I think that's something to truly celebrate and not be angry about, because you have heard some pundits on certain media things, or you get some sort of social media post that you don't know where it's coming from. I think what's going on in the world of research right now, when you compare this, when I had beautiful chestnut hair before my hair turned white, you would be as thrilled as I am. And it's not only just thrilled because it's always nice to be proved right. That's what obviously we all like to be right. But to realize that current and future generations are going to have something that will really help them be healthy and cure real problems with sustainable products from nature that have been in use for thousands of years, but now we're going to improve on that. And not only improve on that, but open up, incredible vistas and economies for everyday people to make good livelihoods for themselves. So I am sorry for the upset that certain people get when they hear the word United Nations or World Health Organization, or they think that the United States pulling out of these organizations is a good idea because they don't want anybody telling them what to do or taking over their health care or whatever. Just maybe listen till the end of the podcast, and then also do your own research. Do your own research. If you feel that encouraging governments to support traditional medicine is something you don't want your country to participate in, well, okay, good for you. That's not something that I particularly agree with. So this is Stephanie Georgia saying thank you so much for spending your valuable time with me. Make sure to check out the links in the program notes. Make sure to subscribe to my Substack, and for whatever subscriptions you want in terms of what I am presenting on Deeply Rooted Botanical Medicine with Stephanie Georgia. And until our next episode, be well.